How's it going, guys? We have past level question, cardiovascular, step one, internal medicine, 2CK. 71-year-old woman admitted to hospital for a fall. She undergoes a right hip replacement, 24 hours post-op, temperature 100 Fahrenheit, heart rate 110, respiratory rate 20, blood pressure 80 on 50, cardiac output is low, pulmonary capillary wedge pressure is high, limbs are slightly pink and warm to touch, which is the following most likely explanation for the patient's hypotension. Let's just whip through choice A, cytokine effect, wrong fucking answer. Obviously, if you thought that this is septic shock, TNF alpha, okay. Long, lengthy immuno discussion, made lots of clips on this stuff. But of course, if we thought it's endotoxic shock due to gram negatives, you're going to have lipid A of LPS binding CD14, aka toll-like receptors on macrophages. Macrophages really cytokines, i.e. IL-1 causing fever, TNF alpha causing hypotension, increased vascular permeability, decreased vascular resistance. We thought that this is superantigen, i.e. toxic shock syndrome or toxic shock-like syndrome. For Staph aureus, strep pyogenes, respectively, you're going to have a bridging of MHC2 on the macrophage with T-cell receptor. Macrophage release cytokines similarly. Wrong fucking answer. Choice B, decreased stomach vascular resistance. Wrong fucking answer. So this is what USMLE is going to do. Okay, so you're looking at this and you say, well, there's a low-grade fever. The limbs are slightly pink and warm. Well, couldn't that point toward septic shock here? So even if we wanted to articulate / conjecture that notion, choices A and B in the setting of septic shock would both have to be correct. That's how you know they're both fucking wrong. Choice B, wrong fucking answer. Choice C, embolic phenomenon, could refer to pulmonary embolism, wrong fucking answer. And we know it's wrong because our pulmonary capillary wedge pressure is high, which is equal not just the pressure within the pulmonary vessels, but your left atrial pressure, okay? And in pulmonary embolism, your left heart's normal. So you could have a massive PE, such as saddle embolus, which would cause acute right heart strain, leading to increased right heart pressure, but that doesn't relate to the left atrium, because obviously the latter is distal to where that embolus would be. So your pulmonary capillary wedge pressure could be normal or decreased in the setting of obstructive shock, secondary to a massive PE. Embolic phenomenon, wrong fucking answer. Choice D, extravasation of the pelvis, of course referring to hypovolemic shock, wrong fucking answer. So PCWP is high. I just said that if you have left heart pathology, that your left atrial pressure would be increased. This is equal to PCWP. If you have hypovolemia, you have decreased volume within the cardiac chambers, your pulmonary capillary wedge pressure is going to be reduced. Okay, so it can be reduced, it can be normal, on the low end of normal. Okay, so it's clearly not hypotension here. You can get bleeding into the pelvis. It's important tangentially that they can give you vignettes where an old lady had a fall and her hip hurts her and she has hypovolemia. She has low blood pressure. You need to know that bleeding into the pelvis is an important cause of hypovolemic shock. Wrong fucking answer. Choice C, myocardial infarction, correct answer, and we know it's correct because it's the only answer here. That's cardiogenic. So our PCWP is increased. It's past level, as I said. I can't tell you how high yield knowing that PCWP equals left atrial pressure and that it's increased in the setting of any left heart pathology or cardiogenic shock, especially in 2CK. You can get a big rambling 15-line massive paragraph where at the very end they just say PCWP is increased and the answer is silent MI. Only answer listed that's cardiogenic. Students reading for 12 minutes trying to figure out what's going on. So there's a few elephants in the room that I will address here. Okay, so temperature is increased. This is normal. This is sympathetic activation, part of systemic inflammatory response syndrome. You do not have to have an infection and be febrile. Okay, it's more of a 2CK discussion as far as SIRS, where temperature under 36 greater than 38 Celsius, heart rate greater than 90, respiratory rate greater than 20, leukocytes under 4,000 greater than 12,000. If you have two or more of those four I just listed, that's SIRS. You can see that in acute distress. For example, you could have a toxic megacolon in the setting of IBD where there's no infection, but the patient's in acute distress, or there's a perforated ulcer and there's no infection, but it's acute distress, and you could see an elevated temperature and you might think that that's sepsis, but it's not. Okay, so I'm just telling you that eventually, for some of you, when you get to 2CK, you'll get some questions that'll throw you off where there's a temperature and there's no infection, it's just SIRS. Okay, so that's why the heart rate's elevated here. It's acute distress. You say, well, what about the heart? That's why the temperature is elevated. It's acute distress. And you say, well, what about the heart rate being elevated if this were an MI, cardiogenic shock? I've seen heart rate all over the place in NBME questions. You can have an MI, dilated cardiomyopathy. You can have any type of cardiac pathology where Heart rate's 30, heart rate's 120, doesn't matter. Okay, heart's not pumping the way it should, so you'd have decreased ejection fraction in this setting. Heart rate can be elevated, it's no problem. And then some of you are going to say, but I don't get it. Why are the limbs warm/pink? Isn't that septic shock? The answer is no. Okay, so this is not specific. In fact, I've even seen NBME. There's an NBME question floating around somewhere. I believe it's on one of the 2CK forms where it's overt septic shock, and they literally say the limbs are cold and clammy, and that throws students off. They're like, oh, I thought it had to be warm. So this is just non-specific. Okay, they can just give you the limbs wherever the fuck they want. Doesn't matter, all right? So your take-home point here is that for cardiogenic pathology, of course, being the left heart, you're going to have increased PCWP. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. And I appreciate your time. That's it.